Good afternoon, everyone, and thank you so much for joining us today for our Facebook Live. My name is Gabby, and I am here with Natasha Robinson, who is the director of the Chemical Use Program at the Boys Town Center for Behavioral Health. So, October is National Substance Abuse Prevention Month. So, today we're going to talk about a very important topic as it relates to children, and that is preventing substance abuse. So, if you're tuning in live and you have any questions for Natasha as we go through our discussion here, please feel free to leave them in the comment section of this video and we can answer them at the end. Natasha, thank you so much for joining us today. How are you doing?
I'm well, thank you. Thanks for having me.
Of course, it is an honor. So, if you would go ahead first and just introduce yourself and talk a little bit about your role at Boys Town, that would be great.
Absolutely. So, yes, as introduced, my name is Natasha Robinson, and I am the director of the Drug and Alcohol Treatment Program here at the Center for Behavioral Health at Boys Town. And I have been with Boys Town a little bit over 17 years, and in this position for the majority of those years. Our clinic provides outreach, intervention, and obviously treatment services for children and adolescents who may be struggling or having a family member that struggles with drug or alcohol use or addiction. Our program serves predominantly adolescent, but we also are able to service adults who may have that challenge. And our program has two different levels of care. I won't go into a lot of detail, but I'll just comment on the level. We have an outpatient service as well as an intensive outpatient, which is just a lot more hours of treatment or intervention for a child that might really have some struggles and maybe has tried traditional outpatient counseling and needs that higher level. So we're able to provide those degree of services to families within the community of Omaha.
That's great. And for everyone watching, I will make sure to link in the comment section the Behavioral Health Center's contact information and website. So if you are interested in learning more or maybe requesting a referral or an appointment, you can go ahead and do that through the link. So I will make sure to do that after this video. So, in talking about substance abuse in children, I know this topic, we could go in really, really deep and, talk about it extensively. But we do only have a short amount of time today. So, we do have a couple discussion questions to go through as an overview. And like I said at the beginning, please comment questions as we discuss too if you have them. So let's talk about the beginning. So, at what age do you think, Natasha, should parents begin talking to their children about drug and alcohol use?
Okay. Well, at this time, the earlier the better. There's a lot of research that shows that by the age of 12 years old, a child may have already been introduced or inquired for using a mood altering substance. So obviously, the earlier the better. What I tend to recommend is giving parents encouragement to really find some teachable moments where maybe you're watching something on television that has exposure to someone maybe drinking or consuming a substance, and having just a conversation with the child about that or what they're interpreting, where it's not necessarily sitting down and talking specifically about drugs, but more of kind of a dialogue that might open up the ability to educate your child, and also help them interpret what they might be seeing. Since at this point, some of what they might be exposed to is normalizing, right? Mom or dad might be having a drink of alcohol, or you may go to a gathering where that's occurring, or they may hear things of people doing, or again in television shows or movies. So definitely finding some teachable moments to talk about it. There's the American Academy of Pediatrics has also recommended that even physicians at this point start inquiring at the age of 10 or 12 in those appointments to find out, have you been offered to use nicotine or other substances, to try and also increase the exposure to teaching to that and helping educate children about the consequences of using those substances.
That's great. So, are there certain risk factors that could result in substance abuse in children?
Sure. There are. There's risk factors and there's protective factors, right? And so some of the risk factors are if there's already a genetic predisposition to addiction, alcoholism, or substance use. Some of the research has showed lack of parental supervision can be a factor. Availability of a substance. Is it pretty available within the household or in certain areas where the child is? If there's a struggle with a mental health symptoms, there's a risk factor that substance use could be more of a factor that a child could fall into. Also, the peer culture. If there's not a lot of knowledge of what kids are doing or lack of supervision, right? There's some curiosity there that could provoke some experimentation or use. So those are some risk factors. There's also protective factors, right? And I want to talk about those just a little bit. Obviously, having some parental structure and supervision can be helpful. Having early conversations, which we just talked about, kind of helping the child understand the risks of using the substances or what could happen. One of the other protective factors is also trying to educate them, but in general about a substance, but also very specifically on maybe how it might relate to them or how it could impact them specifically. If they're into playing sports or, they have these interests in things that could really be problematic if they fall into a substance use, talking to them about that. It helps create that connection of, oh, I wouldn't want that to happen, or that would impact my performance on playing a sport or engaging in something. It helps kind of keep that connection for that youth or that child in recognizing how it could impact them specifically.
Mm-hmm. Yeah, that's great. I feel like so often when we talk about substance abuse, we talk about risk factors, and I wasn't really familiar with those, preventative factors. So I'm really glad that you mentioned those.
Yes. I will say one of the other things that a lot of research has shown recently too is one of the most impactful factors to prevent substance use is the parent-child relationship, right? So the ability to communicate and have dialogue and an ability for a child to openly share with a parent maybe something that they saw or that they were exposed to a situation. So that's really a protective factor. And it's something that parents really have to take the effort in, right? And I use the example of whether you're preaching or teaching to it, right? Preaching is sometimes kids kind of shut down. They don't want to hear mom and dad talk about it over and over again. So it kind of goes back to how you might approach that and being inquisitive about your child and what they have going on. And in that, asking some questions of if there's some peculiarity of things that you might be hearing going on at school and saying, okay, well, it sounds like there's some things that happen at school that can maybe be uncomfortable. Or I heard, sometimes there's something going on in the school that might allow you to inquire a little bit more about that then opens the dialogue with the parent instead of maybe feeling like the child is being interrogated or investigated. And sometimes that defensiveness comes up with children and teenagers naturally because they're at that place where they want their independence, and we certainly want to foster that, but we also want to, as parents, be protective and really open up that dialogue. So if there is a challenge, they come to you and can talk to you as the parent so that you can better address it.
Mm-hmm. Natasha, I think your camera may have turned off.
Oh,
We can
let me
hear
fix
you,
it.
but we can't. Yeah, I can't see you anymore. I don't know if it's snoozed or not, but
Oh,
there you
it's snooze.
go.
I'm here.
All right, that's great. I love what you said too about just maintaining that open dialogue and really giving parents, these action items of things they can take away from this talk, and preaching versus teaching. So often too, I think as parents, we may not even be preaching on purpose. It kind of just comes out that way. So definitely being aware of the way we are presenting these topics to our kids so they don't shut down, I think is really great advice.
Yeah, yeah.
Yeah. So, talking more about prevention, then, how else can parents help prevent their children and teens from using drugs and alcohol?
So definitely that open dialogue. Also, just being aware of any behavioral changes that might come out of nowhere, whether it be suddenly a change in their peer group or a little bit more isolation. And keep in mind, obviously, if you're an adolescent, some of that is pretty normal, right? They're at that place where they're seeking that independence, so more time in their room or more time in their phone. But where it really appears like you're, what's that about? Or loss of interest in things that they were once interested in. Those are kind of signs that provoke exploring a little bit more about what's going on, and hopefully allowing that teen to have some open dialogue so that they can, and if it's not the substance use, maybe finding out what it might be, right? Because adolescence is a tough time period, really trying to become who they are, but also impressionable amongst their peers and wanting to be liked. And so any sensitivity that you can show to that and open dialogue can help prevent kind of that movement to some substance use or some experimentation surrounding that.
Yeah, and let's say, maybe what would you recommend if children have used drugs or alcohol maybe one or two times already and, have tried it before? How can parents talk to their kids about discontinuing that use, maybe if they've already partaken in it?
Well, and that's where sometimes a balance of dialoguing and also providing consequences for poor choices, right? Regardless of whether they skip a class or they've experimented with nicotine or a mood altering substance, and going back to kind of, there's been a trust violation and we want to see you make better choices, and how can you build that trust with us, or how can we see you be a little bit more accountable? And that might be where there's some really good dialogue about how do you say no to using. If the child is able to acknowledge like they were tempted because everyone else was doing it, or it was a situation that they felt uncomfortable with, really helping them build their resistance skills and their confidence in being able to say no, as well as finding reasons why it's important to say no. And that's where a consequence base can kind of come in to help kind of create a level off where they see, being grounding isn't fun, or losing their phone isn't fun. Or mom and dad saying, you know what, you can't have a sleepover right now because our trust level isn't there for that to happen, where you can help that teen or help that child kind of increase their motivation to avoid those type of decisions again, right? So if it's early experimentation, that's one of the most important time periods for a parent to be pretty proactive, right? Send a consistent message, reiterate, you know what, everybody makes mistakes. How can you learn from this? And then working to move on and build that trust level so that they can foster that independence and be aware that they can make better decisions for themselves.
Mm-hmm. Yes. So in 2021 here, what substances are children and teens using the most as of lately? Just so parents watching can be aware.
Yep. So we know the traditional nicotine and alcohol use, and obviously the cannabis is quite prevalent right now. It's being used in a different form more frequently now, whereas at one point it was smoked, and now it's being used through a vape. So the THC, the concerning piece of this is that the THC is a lot more potent. And so the impact and the effect that they get is much more enhanced, which tends to be a little bit more problematic here because they're getting that endorphin high, right? It feels really good. And that's the part that can be kind of addicting to a teen to continue to use and use. It's also less detectable because it doesn't have the scent as traditional marijuana or cannabis. It's in the THC juice format. So just being aware of that, one, for parents to be educated, because kids are slick and they find a way to do things, and there's a lot of ways that's helped out with our culture these days. And with cannabis, obviously we know it's being legalized in certain areas. And so teens tend to have a misconception that it's safe because it's legal. And I always tell parents, don't fall into dialogue about that. Stick to the facts, right? It is illegal for you. We do know it impacts the brain development. And we know that it's in the United States, it's nowhere legal for a child or a teen to use, and there's a reason for that. So I really challenge parents to not get into the dialogue of whether it's harmful or not harmful. Teens are smart. They can find their data and their information. But you go back to the expectations in your household and obviously the facts, it's going to be very hard for a child to dispute that. Also coming at it from an expression of concern as a parent versus really kind of getting into the battle about cannabis. But those are the substances that are pretty prevalent still in current time. The other substance, which could be multiple, is some prescription substances are currently on the rise. And what we've learned is the ease of obtaining a prescription, whether it be in your own household, some prescriptions kept somewhere where it's accessible, or individuals that are on a prescription for the right purpose by a physician, but the pills are there and accessible. And so unfortunately, we've seen an increase in that. And that can be very risky because obviously it's something that's prescribed for a purpose. And if a child is taking it for an ulterior purpose, not medically monitored, it can be very risky to their own health. And they can have reactions that are not typical or that could be and warrant an ER visit, unfortunately. So unfortunately, that is something that's on the rise that we definitely want to educate kids on, and reminding them that even though it's a prescription can be given by a physician to someone, it doesn't mean that just anyone can take it. Right. And if you're taking it for the purpose of getting high, there's an immediate risk to problems that can occur surrounding that.
Yes. So we talked a little bit about kind of the signs and, changes in mood or skipping school. Are there other signs that parents should be aware of substance abuse? Especially, as you said, our kids and teens are so sneaky these days that they'll go to, great extents to hide it. Yeah. So how can we really be cognizant of it?
Yeah, and I think being on the alert, not only in a change in behavior or mood. It could be a change in mood where they just seem a lot more irritated, or you're trying to just dialogue with your child and they're pretty defensive. I think there's a couple things. Obviously, looking if there's some warning signs, you might want to take a look at, are there any paraphernalia or anything that you might be able to detect or find. And if you find something, certainly that warrants a conversation to learn a little bit more about what's going on, and also an opportunity to talk about the risks associated with that. What we also know is generally, if there is a problem with using a substance, there tends to be a co-occurring issue, or we call it co-occurring diagnosis. So some adolescents that are struggling with depression, anxiety, ADHD, they are more prone, again, the risk factor, they're more prone to falling into substance use. That's what research shows us. So if there is an issue with mental health, with depression, anxiety, that's why it is important to make sure that they are getting the help that they need so that we can prevent them from falling into something that is further problematic and much more difficult in treating that mental health disorder or diagnosis.
Mm-hmm. And we also did get a comment left on this video too, and they're reminding us, if kids don't have an interest in the things that they used to love, that is another sign.
Right. Yes.
That could be sports, friends, anything.
Right. Absolutely. And declining grades can be another example of something that could be correlated. It definitely warrants anything that kind of alerts a little bit of a question mark in a parent's head, and suddenly the question marks are 3 or 4 more. It certainly may be worth exploring that piece, or doing a little bit more exploration of whether a substance may be used. And what we know, you put something in your body, a substance, it's going to impact, it's going to change those. Again, it goes back to the endorphin, right? There's a function of using for a lot of individuals, especially if they're using quite frequently. And when I say a function, meaning there's a reason, right? It feels good. Everybody's, whatever that function is. And as a clinician, that's what we try and address. What is that function and how can they find it in a healthy way? How can we find some healthy options to prevent them from continuing to fall into using a substance that might make them feel good or might enhance their confidence, because it's the wrong direction in helping enhance their confidence. And we know that as parents or as, clinicians, but that kiddo might not see that yet. And so it's going to be our job to help them see that they can build and they can find healthy options for themselves and engage in positive and healthy things without using a chemical in their body.
Mm-hmm. Definitely. So we do still have a few more questions on our list, but we're going to take a break here to answer one of the questions that was left in the comment section. So
Absolutely.
This user is asking, do you have any recommendations on breaking the chain with children who have an alcoholic parent? Is early awareness and intervention better with children under 10 years old? So it's kind of two parts there.
Mm-hmm. Mm-hmm. Early awareness, absolutely. Also, though, want to be sure that they're cognitively able to register what you might be teaching to them, right? So if they've seen a mom or dad or a family member that struggled with addiction, certainly a great learning opportunity and teaching moment for that child to understand the risk, right, or the behavior. And that's where, early intervention can come into play, but also kind of bringing it down to their level, right? You don't want to have a full dialogue about how it impacts the brain or different components yet when they're maybe 8 or 9, but certainly talking about, this individual and maybe why they're behaving the way they do and what can happen when you use a substance so much that it can kind of change how they might make decisions or whether, they're able to be there for another individual.
Yeah, and then with breaking the chain for children, excuse me, who have an alcoholic parent, you
Mm-hmm.
did say genetics plays quite a bit into it, but is it possible to break that chain? And if so,
Oh, yes. Yes, it sure is. And, there's, besides the therapy services, there's some great support groups out there, Al-Anon, Alateen. So there's support groups for individuals and even teens who may have a parent or someone important in their life that has struggled with addiction. And that's a little bit different than the counseling. Obviously, that's a support and being able to relate and understand how that can be impactful to the teen or the family dynamic. So that's always a good resource as well. But yes, there's certainly ways of breaking that pattern. And I think that goes back to kind of fostering that individual or that child and really building them up to recognizing that they have the control and that they can make good decisions for themselves. So having a genetic factor is not doom and gloom and, they're going to suffer for this if they use. No, we want to empower that child or that teen, and you can take control of this. You can make different decisions, and reinforcing and fostering their ability to be successful and overcome challenges.
Yeah, that's great. And similar to this question, we did have another comment that was just left, and they are asking, what can we do for a child who watched their father pass away from addiction? What kind of resources would you recommend for that?
Well, that sounds like there's two things there. There may be some grief, as well as obviously the destructive pattern that can happen with addiction. So certainly give them some supportive options, whether it be counseling services, support groups, anything that kind of helps them process through, right? And I don't know the age of this individual, but depending where they're at age-wise, no matter what age, grief is a hard concept, and there is no time limit on grief. It's something that each individual has to kind of figure out how to work through. And that's where having a resource of, someone that they can process with, if there's a trust and rapport built in clinical work, can really help foster through some of those feelings. I'll mention the word trauma just very briefly, but sometimes those type of exposures can be traumatic. They can create some difficulty within themselves in being able to process. And we want that child or that teen to feel comfortable enough to process it so that they're not kind of stuck with it in their head or holding on to the grief that then can result in some poor coping skills that could be developed. Not always, but obviously we want to make sure that these children and teens have some healthy outlets. And sometimes mom and dad are open and they want to be in dialogue with their child, and sometimes a child may just feel a little bit more comfortable processing with someone outside of mom or dad. And ways that you can tell that might be if they say they don't want to talk about it with a parent, or they don't feel comfortable, or maybe you've tried a couple avenues and they're still kind of closing down. That might be a good sign to touch base with a clinician or a therapist that might be able to help them kind of process through it and find a neutral place to do that besides having mom and dad.
Mm-hmm. Yes, definitely. Thank you for those who are leaving questions. We will answer the remainder here at the end. So if you're watching and you haven't left a question and you have one, please feel free to comment that now so we can get it answered in time. Okay, so my next question is regarding consequences. So what would you recommend as appropriate consequences for kids and teens who are caught using substances?
Okay. Well, the traditional that parents hold, generally, if it's a teen, is grounding, loss of a phone, or technology on the phone. I know phones sometimes are a protective factor in being sure you can get a hold of your child, or in communicating rides and different things, but there is an ability sometimes to shut off the technology or the social media components of a phone. Increase monitoring, more chores in the household, some of those traditional, maybe smaller consequences. The big ones that parents use tend to be the grounding or loss of phone, or even loss of driving privileges if you're 16 and over. And what I would encourage parents to do is either link it to the ability that they have to build trust and how they could regain that, and even having kind of check-ins each week or every other day of how do you think you're doing on building trust, or maybe giving feedback on what they're doing well. Consistency is really the key. So we want the teen to be consistent in building that trust and gaining momentum and understanding, because it's not necessarily all about the consequence, right? We want them to learn from that poor choice and be able to have the other skills or resistance skills to make a different choice. And so obviously role playing could be a piece of that. Like, how would you handle this situation if it were to happen again? Or let's talk about what it's like when you have a couple peers encouraging you to do it. Like, what are some ways that you could say no? And even doing role plays and challenging that to become a routine for a consequence.
Mm-hmm. Yeah, those are all great ideas. And just as you said, that, you're not just punishing them to punish them. It comes back to the break of trust and the rebuilding of it, and hopefully making a better decision next time. So there's always meaning behind it. Yeah.
Right. And sometimes you can tell that your child is already feeling the consequence. They may feel shame or, they guilt surrounding the choice that they made. And that's already giving you the recognition. Oh, so they've gotten into trouble is already eliciting some changes and maybe some different decisions that they can make in the future. Mm-hmm. But it's kind of, you want to be careful that the punishment meets the crime. And when I say that, obviously we want the result is wanting to see our child make a different decision, wanting them to foster more of that self-worth and ability to say no or improve in that. And so sometimes if it becomes too heavy, then a child might feel like they can never get through, or they're suddenly not as motivated to do what the consequence is or what they need to earn to remove that consequence. So really being sure the punishment kind of fits the crime. And I tell parents, if this is something that's reoccurring and it's happened 2 or 3 times, certainly you want to increase that consequence base. And you can relay it in that way. Now, John, this is the 3rd time you've been in trouble for this same thing. We are really concerned. And now it's showing that we need to increase and do a little bit more monitoring, or you need to be grounded longer because you're doing the same thing. I think if it's a substance use issue, if it's something that's reoccurring, it's definitely alerting you to a problem level. And so if it's something that's happening a little bit more frequently, it may warrant exploring that. Again, proactive rather than reactive. And so sometimes we have families that come in after a couple times of their child getting into trouble for the same thing that might involve nicotine or cannabis use. And we want to explore that a little bit. Maybe it's not a real bad problem, but if it's something that's continuing to happen and surface, it certainly warrants exploring that a little bit further than maybe parental consequences.
Yeah, yeah, definitely. So let's say, like you said, it's happened 2, 3, 4 times. What would you recommend parents do if they think that substance abuse becomes a very serious problem?
Definitely reach out to a program or a clinician or a therapist that can explore that a little bit more. And there's a couple avenues of doing that. One is a more formalized clinical way. It's called a chemical use evaluation or a substance use evaluation. And the purpose of that is it's a clinical examination that involves a couple assessment measures, a clinician, and review of a criteria that's nationally known. It's called ASAM. And it really explores, is this an issue? And if this is an issue, what degree of treatment might be recommended? And that becomes kind of a starting point of whether maybe someone needs to participate in therapy services or not, or to what degree. The other avenue is just talking to a clinician and providing some routine therapy services. And so that may be having them come in and mom and dad and the child talking a little bit about the concern, and then the clinician working with that kiddo in developing improved coping skills or finding ways to avoid the trust violation of using a substance. So either one is a good start and proactively, because sometimes parents aren't sure and you don't know, because kids can be very sneaky and they might not always be honest. And even when they come into our office, sometimes they are not fully honest. And so we have the ability to use some assessment measures and also some of the expertise to really explore, is this really an issue? And what's kind of really going on? And so a lot of parents will say, I just don't know. And that's okay. And that's where seeking professional assistance to explore it might be very beneficial.
Mm-hmm. Yeah, and those assessments can be done at Boys Town at the Center for Behavioral Health, right?
Yes, they can. Mm-hmm.
Great. And lastly, what other resources does Boys Town offer when it comes to preventing substance abuse?
Well, we have the Boys Town Hotline, which and we also have a text line, which teenagers like this texting thing, and so sometimes they need an outlet to process what's gone on that's outside of mom or dad, and maybe not regularly like therapy, but they can certainly. And I always tell parents, let them know that, like, if you don't want to talk to me about it and you're struggling with this, call this hotline. You can talk to somebody, or text this line and you can talk to someone about it. Parents can also call and, talk about what their challenges are with their child, and receive some guidance or support. So that's always a good option. And it's a quick one. It's something you can do fairly easily, no matter what time it is. So it's a 24-hour line. So we really encourage that if there's a struggle going on and you just need some sound words. Obviously, our program can do the evaluations, and we're certainly opening up to, talking to a parent that might not be sure and want to talk to a professional to just find out, do they need to come in for a service or do they not? I'm the director of the program, so I'm able to kind of dialogue with parents to help kind of determine whether that's important or not. Support groups in the area. Obviously, we have Alcoholics Anonymous, Narcotics Anonymous. Now, those are support services more for adults, but some teenagers certainly go and can connect. There's Alateen, Al-Anon. So there's some support networks there. Certain church affiliations do have support groups as well, and teen groups for specific concerns related to substance use. Not all, but it might be worth a parent checking out their affiliated church to find out if they have any of those resources.
Mm-hmm. Yeah, and of course, too, boystownparenting.org has an array of resources. I was just browsing through them right before this chat. If you just go to the website and search substance in the search bar, you can find every single article, email series. I know the Today's Teen is a really good one, so I'll link that and a few others in the comment section as well. So Natasha, this has been such a helpful chat, especially on a topic as important as this. So we are so grateful that you could hop on and join us.
Absolutely. Thank you for having me.
Yes, of course. And if you are watching this later on and have some follow up questions for Natasha, feel free to message them to our Facebook page, and I will go ahead and pass them along to her for you. So, thank you so much, everyone, for tuning in, and we hope you have a great rest of your day. Bye bye.
Thank you. Bye bye.